Hi, I'm Anki Dudani, and we're going to walk you through the checklist for the spinal anesthesia teaching model.
So, take a time out to verify the patient's identity, the procedure that it's being done, whether consent has been obtained, the site, place a pulse oximeter and non-invasive blood pressure cuff on patient.
Time out. This is patient Joseph Smith. We're going to be performing a spinal anesthetic. The consent has been obtained, and I will now place a pulse oximeter and normal blood pressure cuff on the patient.
Verify that spinal kit tray, non-sterile and sterile gloves, correct size, and cleansing solution are present.
Here we have our spinal kit, we have our sterile gloves, our cleaning solution, and our non-sterile gloves.
Palpate the superior aspects of the iliac crest and identify the intersections at L4 spinal process. Use skin indentation to indicate the proper position at the L3, L4, or L4, L5 interspace.
I'm going to palpate for the superior iliac crest, follow that to the midline. I've identified my L4 and L5 interspace, and I will make an indentation at the superior aspect of the inferior spinal process.
Step 4. Clean the overlying skin with chlorhexidine and widening concentric circles.
I'm going to put on my surgical mask, open my ChloraPrep, and in concentric circles, clean off the patient's back.
Step 5. Open the spinal tray before placing sterile gloves on.
I will now open the spinal tray.
Step 6. Put on sterile gloves with proper technique. Remove jewelry, ID badge, wash your hands.
I'm going to remove my pager, my ID badge, my phone, take off the non-sterile gloves, prepare my sterile gloves, I'm going to wash my hands with gel. Once dry, I'll put on my sterile gloves.
In the next step, we will apply the sterile drapes.
In the spinal kit, I'll locate the sterile drape. Making sure to not have it touch anything else. Remove the sticker. Open it. And apply apply to the patient so that the window is where I mark the initial skin.
Verify the content of the anesthetics before drawing it up. Draw up lidocaine in a 3 cc syringe and bupivacaine in the 5 cc syringe. Warn the patient that you are about to administer local anesthesia. Re-identify the intended interspace after the patient is prepared and draped. Using the smallest provided needle, make a wheel of local anesthesia at the previously marked site. Ask assistant to add morphine to your bupivacaine syringe.
I'm going to verify the content of the anesthetics before drawing them up. In the kit, I have epinephrine that I'm not going to be using, spinal bupivacaine at 3/4% in dextrose, which I will be using, 1% lidocaine for the local wheel, which I will be using, my introducer needle, my needle for local infiltration, my filter needle, my spinal needle, right here. So first, I'm going to draw my lidocaine in the 3 cc syringe. I'm going to switch the needles to the low gauge. In the 5 cc syringe, I'm going to draw bupivacaine. I was using this filter needle. The dose of bupivacaine ranges, so you have to decide what you need for that clinical case. I'm going to ask my assistant to apply morphine into the bupivacaine sterilely.
Now, you're going to inject anesthetic in the correct location and angle. Superior aspect of the inferior spinal process in the midline. Approximately 15 degrees cephalad, as if aiming at the umbilicus. Horizontal plane perpendicular to patient's back, like you'll be doing, maintaining a needle in the midline position.
So from the step prior, we're going to re-identify our space in the sterile field. I can feel my L4, L5 interspace. My finger, I'm going to infiltrate with the local anesthesia. Just warn your patient that they're going to feel a little pinch, and you want to raise a nice skin wheel. Administer some more local anesthetic. With the introducer needle,
in the middle of the interspace with slight cephalad angulation of 10 to 15 degrees. The bevel of the spinal needle should be in the sagittal plane and advance in orientation as described above.
again, after identifying, the introducer needle goes in at a slight 15-degree cephalad angle, maintaining the midline. The bevel of the needle is important if you are not using a pencil point spinal needle, but we are using a pencil point spinal needle.
So,
as you can see, there's a stylet inside the spinal needle. And I will now
advance through the anatomic structures until the subarachnoid is reached. May experience a popping sensation as the ligament flavum is crossed.
I'm going to place my spinal needle through the introducer needle in advance till I feel a popping sensation.
We draw the stylet each time you feel a pop to assess for CSF flow.
Feel a pop.
And you confirm CSF flow by aspiration before and after injecting your anesthetic.
You can see that there is some fluid coming back. It's difficult on the camera, but there is some CSF coming out. That's our confirmation that we are in the correct area.
If attempt is unsuccessful, like bone encounter, no CSF flow, we draw the introducer and the needle and the spine needle to the subcutaneous tissues without exiting the skin and redirect the introducer needle. After you inject your local anesthetic, you should remove the needle and introducer needle at once.
So we're confirming our CSF flow. As you can see, the drop of fluid. I'm going to hold the needle at the hub. Make sure there's a secure connection between my syringe with bupivacaine and morphine. I'm going to withdraw, and you see a positive swirl of CSF. Inject the medicine slowly. And then at the very end, after injecting, I'm going to aspirate one more time to confirm I'm in the CSF space. And I am. And all at once, I'm going to pull out the introducer needle, the spinal needle, and the syringe.
Apply pressure with the Provide 2x2 gauze, assess for good hemostasis, and apply bandage. After, you're going to remove the draping, lay the patient back, and you observe vitals. Dispose of all sharps and biohazard material appropriately.
I'm going to apply pressure with the provided 2x2 gauze and assess for good hemostasis. Once I'm done with that, I'm going to place a Band-Aid over the patient's back. The area is no longer sterile. And we're going to lay the patient in the lateral position. Thank you. After laying your patient on his side and vitals being stable, make sure to throw away all your sharps into a sharp container. That's the conclusion of the teaching module checklist for performing spinal anesthesia.